Good morning. My name is Dr. Wayne Wightman. I work here at Holtorf Medical Group, and pleased to have my patient here with us today, Brett Whittaker.
Glad to be here.
We've been working for the last couple of weeks and kind of wanted to go through his story. So I talked to him on the phone through a Zoom consult about a month and a half ago. He came out to our office like 10 days ago. He's staying for 2 weeks for treatment. Brett's been sick for a whole long time with a lot of complicated things, primarily Lyme disease, chronic fatigue syndrome. In his words, he used to wrestle gators and had a lot of tick bites, and noticed back around, what was it, the age of 10,
Between 10
12?
to 15 years old.
10 to 15 years old, where you had different tick bites and you
head
started getting
pains
sick.
and
So
knee pains, yeah.
what are some of the first symptoms that you had?
So between 10 to 15, I started noticing weird headaches and head pains. I would take ibuprofen, never touched a lick of it. So eventually, as I got into my later teen years, I never touched ibuprofen and NSAIDs again for the most part because it didn't do anything.
Okay.
I also had weird knee pains, like what I now would call fibromyalgia, which for me is more of a symptom than an illness, right? And those lightning pains in muscles, and they became more consistent over time. And it was around when I was 24 years old. I was in really good shape, was running, athletic, wrestling the gators, all of that, back in Florida. And I woke up and my knees felt like I owed money to the mafia, and they hit them with a bat. I couldn't walk out of bed. I was almost in tears. I was just so scared of what was going on. Didn't have insurance, didn't have money, didn't know what to do. And it turns out that the anxiety and the things that come with Lyme and the brain fog made it harder for me to even think about how to help myself. So it was many years until I found a naturopathic doctor back in North Carolina, where I'm living now, that was able to determine that I had Lyme. So,
Okay. And then when I first met you, some of your key symptoms were classic chronic fatigue kind of stuff.
yes.
Trouble with sleep.
Yeah.
You can elaborate on what I kind of remember by memory.
Yeah.
Fatigue, achiness. You had some twitching in your arms.
Oh my gosh.
some
So my
nervousness.
nervous response, whether it was from dehydration, which also has to do with my inability to eat. I found out in the last few weeks recently, actually, that I don't even think I mentioned this to you, that a lot of my dehydration symptoms are also hunger symptoms. Because with the Epstein bar, which is off the charts from what I consider it's really high, it's making me really ill to where I don't even want to eat. I have no appetite, can't stomach anything, even foods that I love that are healthy. And so, it's when I ate though, and I'm able to force myself to eat, then I get this rush for water, where I get this panic response with the nerves. But when I eat, I'm able to force myself to eat a little bit. Within the hour, the dehydration starts to subside. But I get the chronic fatigue, the lightning pains in the joints, the muscles, even in my bone, like in my marrow. It's quite difficult to almost explain to most people if they've not experienced it. Obviously, I have the hypercoagulability. My heart has been like slowing down and seizing before I came here. Now it's definitely it's getting better. It's going in the right direction, but I was almost not able to make the trip. My original appointment had been March 26th. I was here because there was a cancellation. Had there not been a cancellation, I would not have been able to make the trip. It was a one-way trip, 5 hours, and if it wasn't for my wife being there with me, I would not have been able to make it. Like even now, I'm still a little shaky. Obviously.
I know you have that. So we did a lot of tests. Some of
Yes.
your other symptoms were classic chronic fatigue things, where it's like you blow a fuse in the part of the brain called the hypothalamus. So all these autoregulatory systems all get messed up. So I got a bunch of your labs done. We went through them, but a lot of the hormones get out of balance. Immunity becomes weak and dysfunctional. You're prone to a lot of other infections. Sleep becomes poor quality and unrefreshing.
Non-existent.
The mitochondria, the energy factories of the cells, become deficient, defective, and not optimal. And many of my patients, certainly all with Lyme, get a problem called crashing when they push themselves. It's hypercoagulation, which is post-exertional dyspnea. You just crash when you overdo it. That's a very complicated problem that very few doctors understand, but it's a big deal. I've got unique ways to help patients deal with that. That's some of the things we're doing. We got a lot of tests on you, and we're working on things to help your sleep, help your pain, help your immunity, balance your hormones, which were definitely off.
Dangerously low, yeah.
Yeah, so like testosterone, for example, you were dangerously low. I'm going to talk later on testosterone separately as another video, but your testosterone was under 300,
Yes.
and you're only 33.
Yes.
So
And
that's
I've always been active and always eaten
horrible.
really healthy too. I've never been overweight. I've always had a really good diet. So
Testosterone's unique. Ideal numbers are like 900, even up to 1200. But under 300 is really dangerous for us. We're much more prone to actually bluntly dying earlier than we should because we're more prone to infections, falls, pneumonias, broken bones, those kind of things. and it's really underappreciated. So a better way to do it is a shot, which we've got organized for you. I
Yes,
think
sir.
you're going to get that when you get back home.
It's already
That'll be a
there.
big plus for you. Another big thing is thyroid done very uniquely. Thyroid helps all of my patients pretty much done correctly, namely T3.
It's helped me a lot already.
Yeah, well, already, but that's a unique one. Like testosterone, I can kind of give you what you need.
Right.
Thyroid, I have to start very low and titrate higher to get you to your eventual dose. We also do some unique testing in the office to assess thyroid along with blood tests. You clearly were low thyroid as well.
Yes.
So it's all about sleep, energy, brain fog,
Inability to
muscle
eat.
stuff,
Yeah.
skin, hair, and nails, so many things that thyroid does. It's actually we learned about the good thyroid, the T3, from psychiatrists, actually, because it actually made their depressed patients better or made their medicines work better. Maybe they didn't even need medicines. Other studies have been done to show T3 giving in the intensive care after a heart attack, helping heart and things. So thyroid's really misunderstood by most. The real hormone is T3, and that's what I'm giving you and titrating you higher. Boosting up your immune system with various techniques. We've got a very unique test that's pending to check out all your infections. You've been told you have Lyme. I saw some markers that look suspicious. I'm waiting for this specific Vibrant study to come back to go through, and we're going to review that, and I'll tell you what treatments are available for that. You also have Epstein-Barr, which showed up. My new therapy that I like for Epstein-Barr is we have a new machine called high-dose ozone with a double dose of ultraviolet irradiation. I read a good book about 3 weekends ago on this machine and how ultraviolet irradiation is wiping out viruses. Not that so much, it knocks down some of the infections like Lyme and that, but that has a different specific therapy that we're going to be looking at and talking about later. But I love the ozone high dose with the ultraviolet
too.
irradiation. I've done it twice myself.
Yeah,
I think
I've done
you've
3
done
times.
3.
Yeah,
Yeah.
it's
And
amazing.
how have you felt after that?
So,
You
like,
feel any different?
The initial day, like, you're maybe a little tired, at least I am, because obviously I have, more complicated issues than just being a little fatigued. But no, come the next day or two, like, I start to feel better. I start to breathe better. The heart is definitely better. So when I first came here, the heart was locking up and seizing. I was on the plane trying to not look like I was having a heart attack. I was trying to, like, just face forward and
What kind of symptoms
meditate.
was that like?
It's just like my heart is like stopping, almost like the blood's so thick almost. Like, I told my wife,
Was there pain there?
oh, pain and seizing and tightness. The whole chest gets tight. Pains here and pains here at certain parts of the arm and the blood vessels. But that's definitely subsiding. I'm getting less contractions. It's still labored. It's a little tight, breathing and everything, but it's definitely better than when I got here Monday of last week.
So Lyme's very inflammatory. So these other infections. That's where the peptides come in, which I hadn't mentioned yet too, but I love the peptides. I think you
I do
had
too.
learned about peptides,
Yes,
and that's
sir.
probably how you found us,
Yes,
and
sir.
I think you told me. And some of the peptides are extremely anti-inflammatory to calm some of this inflammation down. So ones that I like, I don't know which one you're on, is BPC, KPV, the thymosin alpha, the thymosin beta. There's one new one that I just found out yesterday that we've got in. It's KPV for injection. The KPV oral doesn't do the same thing as the injectable one does.
Actually, I was doing, before I came here, I was doing TB 500 with BPC 157 injections, along with TB4 Frag Max and BPC capsules. And I was front loading because I knew the trip was coming. I was trying to get my system better. And I took KPV injections.
You had the KPV injection?
Yes, sir. Yes, sir.
I've got it in.
Okay.
I've had a couple patients. One guy was interesting. He learned about this on his own after watching some Dr. Holtorf videos on peptides. He found KPV injectable. The first time I heard about it is he was doing big doses of it. He said it absolutely took his brain fog away. He was kind of interesting. Well, he wasn't interesting in that he said he bought a new fridge for his garage and bought 3 years of the stuff because he never wanted to run out.
Right.
He said nothing has helped his brain fog like that stuff. So since then, I've talked to others that have had that same benefit by the injectable.
Yes.
So if you don't have some, we could arrange that.
Yeah, I used to
back with you.
Right, I used the last of it when I right before I came here. I was doing about 2.5 milligrams per injection.
Okay.
Yeah, I was doing 2.5 milligrams per injection at night before, the nights leading up before I came here, of 2.5 milligrams of BPC, KPV, and TB 500.
I like the injectables. I
Yes.
like some of them orally too, though.
Yeah.
I love the BPC to get in the gut. where
I
really
do
is
have
doing
the
it.
gut powder and I have the capsules. So I did the injections especially, not just for the inflammation response, just to, like I said, front load before my trip, because having the Lyme and all these, these symptoms, I know a little bit of stress sometimes will just trigger it, right? And all of a sudden you can't almost control how bad you feel. And so I tried to cool my system down, as I call it. I need to cool it down before I came, and it definitely helped.
Peptides are a big help.
They've saved
So
my
many of
life.
patients.
I would not be here without peptides. Yeah.
I didn't specifically ask you, though, do you think the KPV directly helped brain fog for you?
I do believe it helped a little bit of the brain fog, and I think it helped a little bit of the, like, almost like pushing back. I don't know if it was the Epstein Barr or the feelings of sickness a little bit. I know KPV is very powerful with the melanocyte. I probably pronounced that wrong. The melanocyte reaction, yeah. And so I do believe that those 3 injections, along with all the capsule, forms of the peptides I was already taking, I was on the Thyroid Pep, BPC, KPV, TB4 Fragmax, and obviously the immune peptide A2 comes in with the KPV. So I was on those 5 along with the 3 injectables, and I front loaded that to cool down and come here, and it definitely worked.
Another advantage of the KPV is direct antagonism against Candida, which is a very frustrating.
You told me.
Yeah, it's very frustrating. Gives you gas, bloating, irritable bowel, leaky gut. So I like the BPC to reverse the irritable bowel, leaky gut stuff, decrease inflammation everywhere. And then the KPV is synergistic and suppresses Candida, and really good.
I've had great results with all of those.
Yeah, so that's all good.
I actually first found BPC from the naturopathic doctor in 2020, who gave me the BPC when they found I had Lyme, and it was integrative peptides. And I started doing research, and I found Dr. Holtorf's documents. I downloaded them all. I've been on all the webinars, anything I can study, and it's been life-changing. So
All fascinating
it's
stuff.
incredible.
One other thing that you told me when I met you is how Thyroid Pep had helped you.
Yes.
Which is kind of a newer thing that we
Yes.
have too. What's your experience with the Thyroid Pep?
So I was on the Thyroid Pep. I can't remember. It was 2-3 weeks before I came here. It was something, maybe 4 weeks, but it was not long before I came here. And it's not just myself. I'll get into that. It was myself at the same time. My mother actually was really ill at the time. She came ill. She was about to go on a trip overseas. She had to cancel. It was fever. She was in bed, couldn't get out of bed. My mother is where I get my strength from. She was military, tough as nails. She's going to be a patient of yours eventually. You're going to meet her, and you'll see what I'm talking about. She's going to be excited. She's excited to see you. But anyway, I gave myself and her the Thyroid Pep. She was already on BPC, creatine, some things like that for her muscle retention, bone density in her brain, everything else. And so when I gave her the Thyroid Pep along with myself, my symptoms within a day or 2 were vastly better. She got out of bed within 2 hours. She wasn't able to be in bed. I started to get out of bed for days. She was like feverish and laying there. I gave her Thyroid Pep, gave her 2 capsules. Within an hour and a half, she stood up out of bed, went to the bathroom. She goes, I don't know, all of a sudden my fever, she goes, it feels lower. I'm like, are you serious? And my mom does not have a thyroid. She was taken out when she was like 16. She's on the medications for it, which is why she wants to come see you.
Cancer that she had, or
No,
was it
just
hyperthyroidism?
maybe that.
The old treatment for hyperthyroidism was removed.
Yeah, it definitely wasn't cancer. It was probably hyperthyroidism, and she, back then, they just cut it out. And so she's been on those medications for years and things like that. So yeah, she's excited to see you and working on it. But the Thyroid Pep has already made a difference for her within an hour. Yeah, I watched.
Beautiful story. Yeah. So that's some of the things we're doing. We've got more things. You're out here for a few more days. You're finishing up your IVs.
Yes, sir.
Another thing that we have done a few times is Prolone, and that's where I inject ozone gas with peptides and some numbing medicine in soft tissues and in joints.
Make it old B12,
And so you had both knees done.
Yes.
And yesterday I did your elbow and your hip.
Yep.
And we'll do a little video after we're done here
to.
because you shocked me when you showed me how you changed after, especially the knee ones.
Yeah.
Tell me about the Prolone.
So I definitely. So
how that
obviously,
worked for you.
myself, I've always been active, whether it was the alligators and martial arts, just running around in Florida. We always were just active climbing trees. Even as into my 20s, I tried to stay as active as I could. Right, I've always been fit, but my knees were the first thing that went out with Lyme disease. Definitively, like I said, they felt like the mafia took the bat to the knees. I always use an example. But severe pain. I still tried to run over the years. I still did my kicking, but every kick, every time I took a step was painful. I just embraced the pain because the doctors told me to stop running, stop kicking. I said, no, because the second I give up is the second I will lose. Not that it wasn't, it didn't cause maybe some more damage. But anyway, so I get the Prolone injections, and, the first night there was a lot of pain and inflammation. It's, it's a fluid pocket, right? It's going to be a little bit inflammation, but the pain was well worth the one evening, because the next day.
Did you sleep that night?
I don't sleep anyway, and so with that pain, I definitely had trouble sleeping. But I, had some THC gummies that I bought here, and definitely helped go to bed. The next day, there was a little bit of soreness and tenderness, but by the third day, I was bending up and down with almost no issue. I could still feel some of the gas moving. By the fourth day, it felt like my knees were at least 50% new. And so, and then that's when I was doing like for you yesterday, and I'll show on the camera later. I was doing like this from the squat position, just jumping off the balls on my feet. I could make myself do that before, but it was slower, more painful, and now I can kick. There's way less pain. And so, like the elbow, I had, for reference for the audience watching, I had bone carved out of this shoulder discal clavicle joint, this discal clavicle joint, which the doctor said he's never seen anybody have arthritis there in either one, let alone my age. And they carved it out there, about an inch of bone in each shoulder, carved out bone in this elbow from the arthritis. There's still arthritis here, but didn't need more surgery. So this arm, whether I'm punching, whether I'm lifting something, contracting, doing this, severely painful. And as of today, right, that snap is far less painful. And this was only Tuesday, and this is only Thursday from the Prolone. So, and this one was far less painful, maybe the first hour or two, and it subsided. But the knees were obviously where you put all your weight, and they were also the thing that was the most severe, the longest. So I anticipated that. And the hip, I didn't feel at all.
And I really like patients after the Prolone treatments to continue on BPC for a month or two, because that enhances the whole procedure.
I don't know if I'll ever go off of BPC, but that's
And I learned from a couple of the gurus that teach Prolone and Ozone IVs. But I think in our office, because of Dr. Holtorf, I'm one of the few that actually puts peptides in with it to really
I think that's
it. So
incredible.
For my experience, the Prolozone's about 85% successful in most areas. I've done shoulders, fingers, toes, plantar fasciitis, soft tissues, piriformis muscle, butt pain.
That's amazing.
Crazy stuff, SI joint stuff.
Sciatic pains, like in the lower.
Absolutely sciatic.
My mom's got that, so there you go.
And the best is, and most frequently I do knees and probably neck, shoulders, and necks and low backs. All of that is.
With the Prolone, do you find that there's any cases where maybe one or two follow-ups over the years are recommended?
Yeah, many patients, one might be 70, 80%, and then a month later I tell people to think about coming back for a second one, 4 to 6 weeks. The medicine's usually working over 4 to 6 weeks. A lot of people come back for a second one. And then maybe a year later, things flare again, and they might need another boost.
Well, I mean, because I figure like the cost is really low. Like for anybody who's concerned, like it's really not prohibitive, I promise you. And it's well worth the feeling I already have. And so like when I come back, probably in the next 3 to 6 months, I'll be back here. It'll be hard to stay away from all these wonderful treatments. But yeah, I would consider it for at least the knees again, because my guess is since that's the load bearing and since I like to kick, it's going to end up being a little
Actually,
bit.
just out of interest, and not to talk a lot about prices, but the
Oh.
old therapy was prolotherapy, was injecting sugar water. But doctor, it worked.
It did.
But you had to do it like 8 times, 3 weeks apart at a crack of $300 a crack. So it was a long process. Prolozone's usually only 1 or 2.
Yeah.
The other big therapy is PRP, platelet-rich plasma.
I've read about those.
But that you often need 4, and a lot of places charge $900 to $1,200.
Wow.
And that's more uncomfortable. It hurts a little more. So it's a lot more expensive.
Right.
I think my Prolozone is equally, if not more effective, doing a couple. So just that's why I'm a big fan of
I'm
Prolozone.
a huge fan of it already. I'm preaching the gospel of that. I have everything here, but we'll go on that. But.
So did you have any concerns or fears or wonders or that kind of thing coming out here, and other things you want to ask me?
No fears. Fear is not something I generally feel. I try to approach everything with as much pragmatism as I can, right? Optimism, but also just a resolve, right? And so I wore my shirt today that I've worn for years. You see, it says "Keep moving forward," and there's a bunch of sayings on the back. And it's a military-owned company that put this. I'm not military, but my mother was, my grandfather was, and so I like this. The idea of moving forward, of putting your head down, just biting on the bullet, and pushing through what you got to push through to get better. Because to get better, you have to keep a positive mindset. You have to keep pushing forward. You have to work at it. If you just lay in bed and you lick your wounds, you will get sicker, and you will eventually perish from it. And so, like, I have a saying that I came up with the last few years, and I say, "Comfort is death." And it's not that you shouldn't enjoy a good book or enjoy a warm bed. It's that you should not make that your end goal to be comfortable all of the time. You should seek discomfort, seek challenges for yourself, including with your health. And so that comfort is death motto for me has really kept me going, because I realized that if I wanted to ever get better, I had to keep moving forward.
Although some of that you can only wish yourself to do so much if you don't have guidance from somebody that can do these other
Absolutely.
things.
And of course, there are times when you push yourself too hard, and I have run into that hundreds of times where I push myself a little too hard, and there's the caveat to that.
So wonderful talking to you. Anything you want to finalize at the end here?
I want to mention a few things. I think definitely the red light bed.
Yes,
Yes,
yeah.
right.
The staff was so shocked. You came out of there. My pain is so much less.
It
Everybody told me
was
about what you told them.
so so when I was back in living in Florida, you lay on the beach, close your eyes, the warm sun would hit you, and you'd almost just fall asleep. You almost didn't feel pain, like you feel so warm and comfortable. And that's exactly how I felt in the red light bed. We did 10 minutes the first time. Last two times I did 15 minutes. So the first time, in about 2 or 3 minutes in, I started to relax. Within about 5 minute mark, halfway through, I felt almost zero pain, and I started to fall asleep because I don't sleep well anyway. There's two different times I almost passed out, and I had to like rock my head to not fall asleep. And when I came out of there, I was refreshed. My pain was less or almost completely gone. My stomach felt better, my head felt better. And so the red light bed is absolutely something that works. It's not a gimmick. It is unbelievably life changing. So
Beautiful. Did you do the PEMF?
yes, the PEMF, and
Did
I
you
used the
feel
sound
that?
therapy. All of it. Yeah, I felt
I
great
like
from
all these
of it.
alternative therapies. I have that stuff at home. I also have far infrared,
I'll be
near
getting that too.
infrared
Yeah.
sauna that I think is a great therapy.
That's actually what I wanted to ask you afterwards is the brand again. I forgot the name
Yeah,
of it.
I'll
yeah.
tell you.
Yeah, yeah.
Yeah. I can give
But
a
yeah, so
plug,
let's see.
maybe not
The red
here,
light
but
bed was great. The Prolone, life changing. I'm on the bio-regulators. So I'm on.
and that's another thing that's new. There's a
Bio-regulators.
great new science that's been introduced by Dr. Holtorf. Very fascinating. Some of it's kind of new. I'm bluntly learning more about them, but they're like very specific peptides, smaller molecules, 2 to 4 amino acids,
Okay.
very specific for each organ. Where peptides are a little more less.
So it seemed like TB4 frag, which is like 4 amino acids of the
Yeah.
thymus. Okay.
Yeah.
Okay.
So the peptides are more generalized and kind of go different areas. The bioregulators are like for heart, blood vessels,
I always call
kidney.
BPC 157 the Swiss Army knife of peptides.
Oh, it's my favorite
Yeah.
one. I give it to most people.
I've helped a few of my friends with various issues from weight loss, depression, and stuff, and everybody.
Yeah. So we're learning more about biopeptide or bioregulators. Fascinating things. Very exciting future. So that's some of the stuff that we're doing for you.
Yeah, and if I could just say one last thing, I want to say to just everybody who's out there, like I said, keep moving forward, especially for the men and the young men. I know it's hard because you may not look sick, you may not, no one else realizes you're sick. You don't want to ask for help. You don't want to show weakness in your mind, whatever it may be. I promise you, you're going to need help. Whether it's your family, your loved ones, your spouse, friends at work. It doesn't matter. You're going to need someone in your corner to be able to vent to talk to. You're going to need support, and it's okay to ask for help. You can be strong as can be. I've done this for 9 years, rotting every day, getting worse and worse. But I almost couldn't do it anymore. I had to find help. I had to seek help, and I had to be willing to go through the process. So bite down the bullet, keep moving forward, get some help. It's here for you.
You just said something really interesting. I've been doing this a very long time. Women are very good at seeking help, being open and proactive. Us guys aren't.
Yep. It's
Most
my wife.
guys I see, why are you here? My wife, my girlfriend, my mom made me come. What's wrong with you? Nothing. But look at your labs.
Right.
We have lots of things to fix.
Right.
So us guys need to be better at our health.
Absolutely.
That was
Absolutely.
a good point you made.
Yes, sir. But I appreciate you all having me here. And I mean, no ifs, ands, or buts. There's no smoke blowing here. You all have saved my life and given me a new outlook on life. And I'm going to do everything I can to help spread the awareness in these products, these treatments to other people. I want to make sure everyone has access to it and knowledge of it. So
I love what I do and love meeting people like you. So wonderful.
thank you, sir.
Great.